Okay. Good afternoon, Dr. Kathleen. My name is Ursula Kim. I'm one of your students in your current class, nurse HP 442. Today I'm going to be making a video on my patient, and the video will be about a 20-year-old who came to the clinic with bipolar and having depression and manic behavior. And this patient is single and lives with a family, has two siblings and parents. So prior to being on medication, the patient reports that she has depressed mood and negative thoughts. States his parents, especially father, is very strict and conducted verbal abuse. Growing up in an authoritarian household, she wasn't allowed to express her feelings in fear of backlash, leading to her dark mood. This mood prevented her from making any friends in school, and she became very isolated. As an adult, she also turned to being an alcoholic person, so she's subject to risky behavior like drinking and smoking and all that. So report her younger brother committed suicide last year by hanging in his room. Report that after that incident occurred, then she became very, very traumatic. In addition, her major job as a saleswoman for the local car dealer makes her unsatisfied. In 2018, she was diagnosed with bipolar 2 and reported having racing and disorganized thoughts for the past years. Bipolar 2 is a serious mental condition which is characterized by extreme mood. Patients with this disorder can become very depressive and can also have manic episodes. The condition is very common, doesn't require lab testing, is treatable, and takes a long time to recover from. Now the thoughts have gotten worse, and she was hospitalized for a week inpatient. She also reported having low motivation, feeling frustrated, and wanting her brother back. She was prescribed Abilify 10 milligram and has taken it on and off. So sometimes she is kind of non-compliant with this medication. About spirituality, false ideas, and delusion thinking. She also report at hedonia, which is the inability to feel pleasure. Patient report that she currently has a psychiatrist and needs a therapist to help her with her mental issues. Patient report that the symptom lasts for about 3 to 4 days and sometimes a week. And patient also report that she sometimes feel anxious, feel hard to control her worries, and sometimes when manic and feel restless most of the time. This patient will definitely benefit from 3 main therapies mentioned below. They will work together because they each focus on different part of her disorder. CRT focus on her cognitive impairment. Individual therapy, interpersonal therapy will focus more on her thoughts, and CBT will focus on her intrusive thought. Cognitive remediation therapy is delivered as a series of practice sessions to strengthen a particular cognitive skill, like working memory or attention. Even though most patients need a combination of pharmacotherapy, either alone or with psychotherapy, may help patients with more major depressive symptoms because of due to bipolar disorder. To better help this patient, one must be able to know their family dynamic also, and how much support they have, and what role it plays in their current situation. The reason I choose this therapy is because it helps improve cognitive functioning, which Clara needs as she suffers from lack of sleep, impulsive delusional thoughts, and lack of control when in her manic state. I will use exercise to focus on the cognitive skills or logic and reasoning to combat her impulsive thought. Also, I will also talk about interpersonal psychotherapy process, also known as IPT. This is an adaptive form of therapy designed to improve a patient interpersonal relationship within a fairly short amount of time, usually 20 weeks or less, depending on how the patient's condition is. Person in therapy may be able to experience relief from symptoms and begin work on any underlying issue, may more quickly than if often possible in other form of therapy. And interpersonal therapies will typically focus on the most pressing relationship problem in order to support the person wishing to make changes. As for Clara, with the loss of his brother, so this therapy mentally is going to focus more on his behavior, the way he thinks, and how what can be done differently to change how he feels about the loss and what he can do to overcome it. IPT can be an attractive therapy option for some because it is short-term therapy. It doesn't take a long time, and it means that there may be less of a chance that somebody with this therapy will drop out of treatment. And the purpose of this may also be to connect, to foster good communication, and make which Clara needs because she shut herself out after her brother's suicide. Doing a focused individual therapy once a week for 2 to 3 hours per session when she comes in will be very helpful to kind of make things turn around for her. Also, we'll be doing cognitive behavioral therapy, which is a short-term psychosocial intervention that aims to improve mental health. Cognitive means all the mental processes of a person, dreams, memories, images, thoughts, and attention are all concerned. Behavioral means everything that a person does, how she tries to solve a problem, how she acts, and avoidance. CBT focus on challenging cognitive deterioration and behaviors, improving emotional regulation, and development of personal coping strategies, screening, categorizing, and interpersonal experiences, and underlying assumptions, conditionally beliefs, and shape one response to experiences, determine how one feels and behaves. For Clara, she thinks that she must internalize her feelings and stay positive despite her scenario. In different situations, she is afraid of expressing her true feelings in fear of being rejected. CBT includes a number of cognitive or behavioral psychotherapies that define psychopathologies using evidence-based studies and strategies. CBT generally includes 3 broad phases, which is one of them being the initial, another the middle phase, and then the ending phase of it. On the initial phase, where the therapist identify problematic beliefs, and that may have the therapist determine specific destructural patterns of thought and why they are destructive to the client. During the middle phase, cognitive and behavioral strategies are implemented to help address the patient's unhelpful thoughts and behaviors. The ending phase of the CBT generally includes an emphasis on relapse prevention of the plan for termination. The specific techniques in cognitive behavioral therapy include relaxation, exposure, social skills, training, assertiveness, training and anger management, and dialectic behavior therapy. Dialectic behavior therapy is where patients learn problem-solving techniques for dealing with stressful events. This therapy is very good in that it teaches the patient that even though they cannot control all aspects of the world around them, but they can control how they interpret and deal with the things in the environment where they live. CBT is very important for this patient in that it is sought to tap into one's thought and generally drives one thought, which is the main motor that drives people's emotion that control how they behave. How therapy influence culture and diversity. Different cultures come with their own varying values, communication styles, and traditions. Understanding the differences in the patient's cultural background can better help in tailoring the therapy session to their needs. For example, power distance is the cultural pattern that locks into how power is distributed in the culture and how people of lower and higher power interact. So in the culture that high power distance, there are clear differences between people and power and no power. For example, a hierarchy. People lower on the hierarchy, like children, will be expected to treat people with hierarchy with more respect. This will enter no talking back, doing as you are told, and identify and definitely not challenging the system. On the other hand, low power, everyone is treated with equal respect, and people that would traditionally have low power are allowed to express themselves freely. When conducting individual power with someone from the culture that values high power distance, you have to make such a big recognition of the fact that they find things such as talking back to their parents as impossible. This therapy would have to focus on decentering the power figures in their life and ensuring that they are aware that their thoughts and feelings are valid. Being aware of these cultural values and how they shape upbringing is extremely important to shaping a therapeutic treatment that is beneficial to the patient. When interacting with Clara, I start with CBT, then CRT, and family, that's IPT. This is because the person has to realize the importance of how their destructive thoughts can affect their feelings and behavior before targeting limitations in daily life and situations that trigger episodes. In addition, IPT can only works effectively if a person is willing to change. Holding on to her core beliefs for the prolonged period of time makes her apprehensive to welcome change. However, CBT can change her thinking towards a positive mindset and make her more welcome to changing her behavior. IPT requires a deep dive into the person's past, so implementing the therapy a few sessions in will make Clara more comfortable to share her past. My expectation for the therapy is for the patient to be closed off due to her core beliefs, but open up more and more due to the implementation of the different therapies. In many African cultures, mental health isn't priority and loved ones often dismiss the topic. When Clara attends this session in regular fashion, she feels proudful as her diagnosis was something she had to hide from her strict family. I will reaffirm her positive thinking when she attends the sessions. So now I'm going to be able to talk to Clara. First of all, hi Clara, how are you? My name is Ursula. I'm going to be your therapist today. So based on what you told me from your last appointment, I think that we're going to be doing, we had the therapy session last appointment, and we're going to be starting with cognitive behavioral therapy. So I just wanted to ask you, since the last time you left here, have you have any issues, or how have you been doing?
I've been a little closed off.
Okay.
I've been feeling very depressed lately because of my job as a saleswoman. I haven't been feeling motivated to continue that job because it's not very fulfilling for me. In addition, my brother's suicide, even though it was a while ago, it still affects me to this day. And I feel as though I've lost a sibling and then I've also lost a part of me in a way. So that has really affected my mood and I've been very shut off to others.
Like the last time when you came in, we talked about you having a journal to keep that you adhere to every day, to just to make sure you write how often you've been having these bad thoughts and feelings, traumatic event about what happened to your brother. Have you really been writing anything down since then?
Yes, I have been writing down some thoughts. I have been writing down that I should have done better to take care of him because I felt that his suicide was on me because I felt that if I had been a better sister, then maybe he wouldn't have hung himself. So I've been writing down negative thoughts such as like, I'm worthless, I should have been a better sister, I should have been a better sibling, things like that.
Okay. So have you been able to also recognize what are the early signs that make you to feel that way? What happened to you? Is it something occurring in your environment that is making you to feel like you keep going back to think about what happened to your brother?
Yeah, because I haven't been able to express my thoughts openly due to my parents, I guess I've just been internalizing these ideas, and that's what's been making me go back to it because I feel I can't move on from it if I can't talk about it. So that's why I came to these sessions in the first place.
Okay. Did you? What do you know? Do when you are witnessing this episode of you keep shutting yourself out? What are you thinking when this happened? How do you feel, and what are you thinking about?
I feel very worthless, like maybe I shouldn't even be in this world. I feel depressed. I just feel like I can't really do anything in those moments because my feelings are so intensified, so I can't focus on anything else other than the situation that's making me feel this way.
Okay, and do you know that now mostly I'm talking about the CRT. Do you know that whatever your thoughts are control the way you behave, your behavior and all that. So actually, like I said, I need you to keep a journal of something in writing where you have to. Anytime you think about anything negative, you put it down. Anytime you think about something positive, you put it down. And you want to be able to, so that we can, on our next session, we should be able to see how positive you are, at least driving your emotions out of what your thoughts out of what happened to your brother, like me and and I want to understand. I want you to understand during this therapy session that your brother is gone. Your brother is gone, and as you cannot blame yourself because I know pretty much you were close to your brother, but you had to work and you do other things. It's not everything you could have done for your brother. But if you start now to focus your attention on any positive things and say that, okay, I know I lost a brother, but still yet at least I think I need to find a better way to move on with life, so that I think about positive, because thinking only about the negative things will kind of not give me a go ahead in life to see that there are still positive things ahead. Especially you are a young person, you have a family, you want to grow up and have a life, have a relationship. But if you shut yourself out, that you are not talking to people, then you will end up just being not what you want to be in life. Hi Claire, I know we're done with the cognitive behavioral therapy, the CBT. That was the first segment of our therapy. Now we're going to go to the second segment, which is the CRT.
Okay.
And now, based on the last, what you told me about the exercise is to help you focus on your attention and logical reasoning. Okay, and I think things like doing meditation should be able to help you with your thought process, because how the bipolar symptoms affect your daily life. That's one of the things. What is happening to you? How is it affecting the way you're functioning? Which basically it looks here, you just get shut up and you shut out of, and you're not talking to anybody.
Yeah,
So
because of my disorder, I do suffer like from insomnia.
okay.
I do like have trouble controlling myself and focusing my attention on one place, so I do need help with that.
Okay, so I think we will have to practice some motor control, which will goes by you opening your fist, and you're going to be doing that slowly.
Okay.
Yeah, you open it slowly, paying attention to every finger as you open them up. Okay, open all of them, all your 5 fingers, and then you go ahead and then close them. Okay,
Okay.
how does it feel?
It feels like I have control, even though it's just like one part of my body.
Okay, but you feel like you have control, and that we'll be repeating that. Okay, but yeah, as then we see how it goes. A lot of time when you having all those things, try to do things like that for yourself. Okay.
What other things can I do other than meditation? Maybe like walking or something?
Yes, you can also do exercise, and also I would also advise you to do like some listen to soft music, not music that makes a lot of noise. Something very soft and gentle, which speaks about positive things. which they're talking about positive things, not negative things.
Okay.
Those are things that can also help you. Okay.
Okay. Thank
All
you.
right. So we will repeat this session, this exercise that we're doing like this for at least 5 times. Okay. On every session when you do it.
Okay.
Yeah. And thirdly, we'll talk about ITP, which is the interpersonal. We'll do the interpersonal therapy. So we are going to our segment 3, okay, which is the IPT, and it talks about IPT stands for interpersonal therapy. And the main focus of this is going to be to improve your communication skills among your parents, especially like you talk about growing up in a very authoritarian home, which you don't have a voice and you can't speak against your parents or any other person, and you think that your views doesn't count or anything like that. And we're going to talk about it. How are the ways we can use to control that? First and foremost, I would really encourage you to improve your communication with your parents. You want to know when to talk to your parents. You want to know when your parents are in a bad mood, and you want to know how to express your view with them, and also to let them know how you feel when you are not able to communicate with them. Okay.
Yeah, so my present situation with my parents and my siblings, like I've been saying before, I've been feeling like shut out. I haven't been responding to them and they haven't been responding to me. So there hasn't been like open communication between us, which I feel has affected our relationship, especially like I said before with my brother's suicide. That has also shut them out, like it has shut me out, but we both haven't made an effort to improve that communication between us.
Yeah, I would kind of encourage that we do something. Since it's a short session, but I'll also let you know, if you and your family plan to go out for a vacation, take some time out together where you'll be in a close area where you can communicate with each other. Okay, like do like a vacation together, go out to eat in a restaurant somewhere where you can, really have that special time with family. Everybody's involved. Kind of put your electronics away, your phones and all that, and just focus on talking to everybody. Let everyone know let your parents really know how you love them, how you feel when you get shut up and you are not shut out and you are not able to really express your view.
Yeah, I definitely think those types of sessions will be important. Like also letting them in, especially with my bipolar disorder, letting them know when I'll be in like a manic episode versus like a depressive episode, so they'll know how to like respond better. Yeah,
so when you get home, talk to your parents about you all planning and taking a short vacation and see what happened, what their response is. Okay? So that when we meet in the next session, then we can see what to do.
Okay, thank you.
Thank you very much.
Have a good day.
Bye.